Welcome everybody to today's Lunch and Learn, which is organised by Northumbria Integrated Care, NHS Trust and Boost, which is the North East and North Cumbria Learning and Improvement Community for Health and Social Care. It's good to see you all today. My name is Richard Laurie and I'm Head of Knowledge and Library Services at NCIC. But it's my pleasure today to welcome Lucy Thomson and Heidi Jobling, who are giving the session on some of the issues affecting British Sign Language users accessing healthcare services, the challenges for staff, and what can help with this. And they're also going to talk a bit more about the BSL Health Navigator service and the work that's going on to improve this. The idea of these lunch and learns is that they're a relaxed, informal space for health and care staff to come together to share experiences, learn something new, focus on quality improvement, and be signposted to further resources. And of course, if you're having your lunch, to munch your way through your lunch at the same time. Just a few protocols for the session. If you keep your webcams off unless invited, and then mute not when speaking. We do keep an eye on the chat through the session. So if you've got any kind of questions or anything you want to add as we're going, do feel free to put it in there. But we also do have a question session at the end, again, which you can either use the chat for, and I'll take those questions through there, or if you pop your hand up and would like to ask in person, that's fine. And then the presenters, I'm sure, will be happy to respond and pick up any issues with you as well, if there's anything particularly you'd like to take forward with them. Just the other thing to be aware of, we are recording these sessions as well. So if you do verbally contribute, you will be on that recording. We put these on YouTube, so again, do feel free to share these if it's helpful. We'll also be doing a survey at the end just on today's session, but also that's a chance if you've got any ideas for other speakers you'd like us to have, or any other topics you'd like covered, do feel free to pop it in there. But without further ado, I'll hand over to Lucy and Heidi.
Thank you, Richard.
Thanks.
Right, was this the bit where I start?
Yeah.
Okay, right. When we went through this presentation, we kind of thought that we should do a little bit of an introduction of Deaflink, because some of you may have heard of us, but we are an independent charity who work in the North East. We work with people with all levels of hearing loss. So we have a hard of hearing worker and deliver services to people who've acquired hearing loss. But our primary work is with people who use British Sign Language. We provide one-to-one support and advocacy. We also provide the social opportunities, so drop-in and chats and craft groups, and we also send out a fortnightly newsletter to the deaf communities, but also to our partners. And also we do some deaf awareness training, and I'll mention more about that later on in the presentation. And one of the things that's most important to us is that we are a local service delivered by local people. So some of our staff are BSL users, they are known within the BSL community, and we can engage a lot easier through that, and therefore well established and quite well trusted organisation within those communities.
So I'm just going to talk a little bit about our steering group, but it's probably better to go a little bit further back in terms of how we started. So we did start a pilot project, a BSL Health Navigator pilot project that was funded by our charities for 1 year, and that was Northumbria Healthcare's charity, Newcastle, and CNTW's. And we developed a steering group to obviously take the work forward, and that was alongside Deaflink, so with Heidi as part of the steering group, but also with 2 BSL users who are our health navigators. So we have been meeting now, I think it's probably the 3rd year that we have been going, and this year we have just secured funding for a further 3 years for the project. And as part of the steering group, we're now trying to expand it because we've identified that there is a gap with primary care. So we're hoping that we're going to have somebody join us now who can input into the steering group around primary care. So yeah, it was just to really give you a bit of a background of how we've come to start this project. We're going to talk a little bit about some of the key elements. And these things really came out of our co-design work that we did initially with deaf patients. And so we realised that there were some real issues for our patients accessing our services. And so when we designed the project, one of the key areas was around communication and information. So understanding that deaf patients were really struggling with interpreters, but also with the information we were sending out. And that links into the next part about deaf patients really needing help to prepare for their appointments. So understanding the letters they were being sent, understanding what they needed to do before they came to hospital. And then whilst in hospital, making sure that they had their needs met in terms of interpreters and staff understanding, the issues for the patients. So raising awareness amongst our staff. And then also part of the navigator's role is supporting discharge home. And so linking in with community services when that's needed. I think another part of the Navigator project is around community engagement and also health promotion. So there's a big gap in terms of public health information for BSL users. So Deaflink and the Navigators support a lot of our patients to understand how they can look after themselves when they do leave hospital. And I think it really is about a responsive service. So BSL users contact the navigators and then they get that support all the way through that patient journey. So I think they're the kind of the key elements of the project. I think we're going to kind of do a double act on this one in terms of some of the areas for improvement that have come out of the project. So, Heidi, do you want to start?
Thank you. Yeah, I think it's also worth mentioning that what we call the Health Navigator program is basically just for north of Tyne. So it's just within even though CNTW is a wider region than that, it is delivered just to the north of Tyne population, and it's not available for people using primary care. So we will work with primary care services when that patient is using hospitals or acute services. So it is fairly limited, and work that we've done in the region has highlighted that people in Sunderland want this service. People who want to access their GPs have got some of the problems that we're talking about in these areas for improvement. This is generic, it's across the country, and I think it's to the credit of the hospital trusts who've worked with us and picked up the issue, because the Accessible Information Standard's been around since 2016, and I think recent evidence is showing it hasn't really been implemented to the standard it should. So as Lucy's already mentioned, we've got some really important things there. The lack of staff training. There's a lack of understanding of the needs of BSL users and hard of hearing to some extent, but specifically, the number of times I've heard staff say things where it's just they might be able to speak to you, but they can't hear you. And that final point, the reliance on online services and apps, I think we'll all agree that in the last 3 years, we have moved towards apps and online access for healthcare, and many BSL users don't own a computer or know how to use the apps. I think the other thing, Lucy, do you want to mention a little bit about the consent to treat?
Yeah, I think this is something that we've done quite a lot at Northumbria Healthcare in terms of our staff understanding the importance of consent when it comes to BSL users, because if they're not booking interpreters, then that person doesn't know necessarily what is happening in that conversation, and then you cannot assure anybody that you've got consent to treat that person. And so it's now become a patient safety issue within our trust. We have raised it as a patient safety issue, and that is how we talk about it now, because there are significant risks if patients don't understand what's being said. And I think that staff don't always understand that interpreters are there for them as well as for the patient. So, there's a lot of training, I think, that staff need to do around working with interpreters and understanding the importance of them. Shall I go on to the next bit, Heidi?
Yeah, thanks. So I'm not going to go through every single one of these, but these are general areas where there are needs for improvement. The one there's two on there, well, actually all of them. So often interpreters are not booked, or people don't actually plan it. So one of the things we've been talking about in the steering group is if you've got an emergency unplanned visit, how can you provide an interpreter? So there have been discussions about using VRI, video relay interpreting, which is not perfect, but it's better than nothing. So it's about working together to find some solutions, but it's quite a simple solution and very few people use it. There's a massive expectation that that deaf person will be able to lip read. Even the best lip readers in the world can only do about 40% accuracy. Or to use written notes. And again, there's a lack of understanding that BSL users do not have high literacy rates. They don't feel comfortable using notes. They often don't understand what's being written down. Appointment communication. So I'm constantly going on about it, but deaf people will receive reams of paperwork which often says, if you want an interpreter, please phone this number, which is just thoughtless, really. And this, when we start reviewing all of the systems that we have for communication, it's not very clear or easy for people. And I'm just going to mention the mental health thing, which is there's a much higher prevalence of mental health issues within the BSL community, but an absolute lack of referrals from primary care services for those deaf people into getting support for their mental health issues. Lucy, anything on that you want to
add? No, I think I would just reiterate the importance of booking interpreters, and not assuming that because someone says they lip read, they can understand all of the conversation. I think most of the complaints we get through is around interpreters not being booked, and being expected to lip read or read notes, and then not understanding fully what the conversation's been with a doctor or a consultant.
And I think the important one on here is the accessible information. It's the accessible standard. The guidelines suggest that you ask a person how they prefer to be communicated with, and then provide information in that manner. And without fail, if you ask most BSL users, they will say they prefer to communicate in BSL. And as Lucy mentioned earlier, when you look at the information we send out about health and public health issues, I think the pandemic highlighted a lot of the problems here, which is the absolute lack of information that was reaching into the BSL communities. And I also think that the delays in treatment is something that is a real patient risk, because if you have a BSL user turn up to an appointment and there is no interpreter, you don't have the video relay equipment. We have found a lot of the healthcare professionals have said, would you like to go ahead with the appointment and use notes? Or would you like to postpone this and we'll try and find an interpreter and reschedule something for about 3 or 4 weeks' time? For me, that's not a decision that people should have to make. If you've got an appointment, you should be going ahead with that appointment. And in some cases, the delays can be quite significant and have a massive impact on that person's health. So one of the things that people don't often understand is the limited access to other services. So especially in this day and age where we have social prescribing and things like that, we have worked with a woman who has had some heart procedure several years ago and is really anxious about it, would like to join other forums and talk to other people who've been through the same experience. We can't find a single organisation who provides interpreters. That's from the British Heart Foundation to services that are available through the Freeman Hospital. They can't provide interpreters, and this person can't afford an interpreter. But if you also think about it in the wider picture of we often get questions about people being accessing Slimming World or healthy eating programs, and again, there is no interpreters. Mental health services and drop-in centres, there are no interpreters. So there is a real lack of access for the BSL users. And the next point, which I think most people in this meeting will recognise, is the reliance on family members. So we had a client last week who was saying they've been asked to bring their daughter to the appointment so the daughter can interpret, which is just not acceptable, and it's not appropriate for either the mother or the daughter to have to do that. And I think sometimes we tend to try to be flexible to make sure the appointment happens, but sometimes it's about not acknowledging the needs of that BSL user and their rights. Is there anything you want to add on that, Lucy?
You mean on rights, sorry, or anything on this top? Yeah, I was just, the only thing I was going to talk about really was the quality of care, because I think for our trust, and I know Newcastle and CNTW, who are all part of our steering group, this is about quality of care. It's about patient experience. It's about patient safety. It's not a nice to have. These things are important to us, and that's why our trusts are part of this project, and are committed to this project. So I do think it's a conversation that more of us should be having.
Yeah. And I think it's also worth mentioning that there's a national campaign going on by an organisation called Sign Health, who have a few contracts with the central government to provide mental health services and domestic violence services to BSL users. Sign Health wrote a report 10 years ago called Sick of It, which highlighted some problems. So one of the numbers I remember is 3 out of 10 people who use BSL actually accessed an interpreter at their appointments on average. They are doing a follow-up on it. 10 years on, has anything changed? So there will be a lot of publicity and events, I imagine, over the next few months where they're raising those issues. And the feedback so far is that very little has changed. People are still failing to get access to interpreters for their hospital appointments. They don't necessarily know what treatments they're having. We had an example last year of a man who thought he was having a hospital appointment, and he was actually being admitted for an operation, and he wasn't aware of it. So it shows the gaps between what we think we are as a healthcare service. We think we're giving information, but the BSL users are not understanding some of the things that are being said.
Yeah. So I think something that we wanted to talk about, though, was the impact of the Navigator service. So I think that having a bespoke service for BSL users has started to have an impact. And I still think that we've got a long way to go, though. We talk about this all the time in the steering group, because unfortunately, every steering group, we have a case study, which is usually a really poor experience of a BSL user in one of our services. But we are starting to see some things change. And I think the health literacy, so I think going back to what I was talking about before in terms of public health, understanding health information, understanding it in in a way that people want to understand it. So I think that that's one of the things that our navigators do a lot, is go through information with people. And I know that it takes a lot of time because they always have to put how much time they spend on these things. And this is one of the things that takes up most of their time. But we are seeing improved experiences. And, you know, I do believe by having the navigator service and by their, you know, and they are constant about this, about booking interpreters. I think that is improving patient safety for people. And I think that this project has increased trust between BSL users and the hospitals that are part of this project, and obviously increasing access. And I think just by having the kind of support that they're given and the advocacy, it is empowering. It is empowering our patients, so they are more involved in their treatment. And you know, and it is holistic support. So as Heidi said, it's very hard for BSL users to access the range of support that is out there. But I think, you know, by working with Deaflink, which is a local trusted organisation, the hospitals are able to kind of support people better as well.
And I think on that line, it is a partnership. So we identify the gaps, the issues, and the hospitals work on how can we improve this. So one of the things we're working with Newcastle is, what do you do when a BSL user turns up at ED and there is no interpreter? You can't communicate with them. They're right in front of you. How do you manage that? So we're working with the staff down there to help them respond more appropriately when a person does turn up, and also understand what's available, because there is a high turnover of staff. There are, you know, people move into different departments or leave, and it's just that constant flow of information, reminding people and helping the healthcare professionals deliver the service to the best of their abilities within the systems that we've got.
So that is it from us. I think, Heidi, you just wanted to mention the deaf awareness training.
Yeah. So as part of the work with the hospital trusts, it was identified that we need to start doing some deaf awareness training for the staff. And then we added up the head count of how many staff that would be, and we don't have enough staff at Deaflink to provide that. So we came up with the idea of an e-learning program. And there's 3 modules. The first module is understanding deafness. So that's actually the different levels of deafness, what it means, breaking down some of the myths. The second part is about communication. A lot of work in there about working with hard of hearing people, because there is a lot of technology available and it's always improving to help people who are hard of hearing access healthcare. And then the final one is about how to use an interpreter and the barriers and what services are there, and more about what video relay interpreting is and how you can get access to that. So there's 3 of these e-learning modules which are available on the Boost platform that I would encourage everybody to have a go at. Should take about 2.5 to 3 hours to get through all 3 of them.
Okay, thank you. And also, if anybody would like to contact us, we've left our email addresses, so please feel free to contact us if you want to. Okay, thank you.
That's great. Thank you, Lucy and Heidi. It was really interesting, actually, very useful, because I know certainly the library service, we do quite a lot of work with helping people with clinical information, but that links into things like health literacy. So some of the slides I was kind of thinking about, maybe we could dovetail some of this in. So yeah, very useful. But yes, do we have any questions? I think I did 1 or 2 people asking if they could ask questions. Alison, got your hand up. Oh, you're on mute, Alison. You're still on mute. Ah, there you go.
Am I on now?
You're on now. You're on now. We
Yeah.
can hear you.
Can I just introduce myself? I'm Alison Miller. I'm a health visitor, works in Carlisle, and I was born deaf myself. So I'm really, really quite aware of what the barriers are, especially in the pandemic. It was really awful because I used lip reading as a coping mechanism, and I found through that a lot of assistance from technology. Now, I didn't hear you mention interpreters. I have to use interpreters for the Polish community and the Syrian community. But what we do is we can actually set up an interpreter via Microsoft Teams. So what I do is I go into the house and I arrange prior to the visit to get him on. Would that be helpful as a way forward?
Do you
Yeah, I
want me
mean,
to take that? You do it.
I mean, I think VRI is now available on every one of our trust's laptops and computers, so we should be able to set that up anywhere, and that includes community nursing. And I think that is the same for Newcastle as well.
It is,
Yeah.
yeah.
Yeah. And it is really helpful. Yeah.
Well, there is another one, and I understand that the deaf community, maybe their reading isn't as good as it should be. But the other thing that I've discovered is on your iPhone, you can actually get live caption. That's another useful tool.
Yeah.
And what about Deaf Relay? Is that something that you could implement, like the app, Deaf Relay?
I think there's a number of things, and like we said with the e-learning module, the second one, which is about the communication, goes into a lot of details about that. The text the relay thing works fine, I think, for people who have hearing loss and have understood or fairly good level of English. For a lot of BSL users who have language deprivation, the text relay doesn't work very well. What was the other one, Lucy? There was I've forgotten the first point. Sorry, Alison, what was the first point you made of that? So you mentioned the text relay, but there was one before that.
It was about live captions again. If the English isn't that good, but the other thing I was gonna suggest is, and I know there wouldn't be interpreters, but it would be just basic. What about introducing basic sign language to the staff?
Okay, Lucy, you do the basic sign language and I'll talk about the live captions. The
Yes.
live captions, there are two programs specifically that we would encourage people to use. We would, Deaflink, which is NalScribe, which you can use on iPhones, and there's Live Transcribe, which are available on Androids. And what they do is project what you're saying onto your phones and people can read it alongside. We have raised it with the hospitals and they have gone to their IT department who've said, no, you can't use it because of the data protection part of it. So the GDPR aspect of where does this information go? Is it saved anywhere? There is no assessment of it. So they have said at the moment, they don't want those apps used within a hospital environment.
Right.
In terms of the BSL, we do offer, we have been offering for quite a few years now, level 1 BSL for our staff if they're interested. So we have been offering that as well in our trust.
Brilliant.
Good.
Thank you.
Thank you for that, Alison. Do we have any more questions? We're just about running out of time, but if there is anybody desperate. No, I don't think so. But as I say, Heidi and Lucy popped their emails up at the end. So if you have got any questions, do feel free to get in touch. And if you do need help in getting in touch, get in touch with us and we'll put you in contact. And as I say, the recording from this will be on YouTube in due course. So if you want to share it with anybody, do feel free to do that as well. The survey also appeared in the chat. So if you'd like to fill that in, that would be good. And if you have you got the link to the have you got the link to the training? Somebody's just asked if you could pop it in the chat.
I'll pop it in the chat. I'll look through it quickly now. Don't have
Karen.
the link to the evaluation though, because I was told that was sent out separately now. So
that's great. Thanks, Karen. And then just the final bit from me is our next session is on the 13th of March at 1 o'clock, and that's on improving patient journey and experience from admission to discharge using process improvement. So keep an eye out from that one. So it just leaves me to say thank you everybody for coming today, but thank you particularly for Heidi and Lucy for giving our session. It was great. Thank you very much for that.
Thank you.
Thank you very much.
Thanks a lot.
Goodbye all.
Thank you.
Thank
Bye.
you.
Thank
Bye-bye.
you. Bye.
Bye.